Hello and namaste, guys. Welcome to yet another episode of the Dr. Anushruti show. Today on board, we have a personality who is a big name in the field of physiotherapy and entrepreneurship, a living example of girl power. She is the founder and director of Physicure Healthcare Private Limited, along with more such healthcare setups. She is the editor-in-chief of Physio Times magazine. Let us welcome all together the bold and beautiful, none other than Dr. Anubha Singhai. Hello, ma'am. Namaste. How are you?
Thank you so much. It's a pleasure to be on your show. Thank you so much.
You're welcome, ma'am. Well, we are looking forward to today's episode because all my listeners, all my viewers really want to know that how a doctor can enter the field of entrepreneurship. Well, my first question is when and why did you choose this step? Why did you choose the step of stepping into the world of entrepreneurship?
Oh, well, like every physiotherapist, I always had this ambition of doing very good in clinicals, and teaching a lot of students for the love of carrying on the academics. So I had all that experience for around 12, 13 years initially. And then after a point, I felt that being practically present in this field, there are certain things where we need to step in. We as physios need to take that initiative to fulfill that gap, to fulfill that loopholes. For example, that the distance issue is there, patient has the difficulty to reach the clinic, there's always that time crunch where telehealth can help. There's a need of a pick and drop vehicle where the people who are senior citizens or of that sort who are dependent on their, the kids and other people to take them for the rehabilitation. So for all those matters, I decided, to have something where we can help out. We don't have to, take that from level 1 to 3 4 to get the permissions and everything. Now, though, the scenario has changed a lot, but back then, 15 years back then, it was a difficult task to make the changes. So that's what basically led to the evolution of Physicure, which is a chain of advanced physiotherapy clinics. So basically, we started with 4 clinics altogether in Bhopal. First thing was to reach to all the 4 corners of Bhopal so that the patient can reach on time, doesn't have to cross all that 1 hour of treatment, needs 3 hours of traveling and everything else. So we arranged our own pick and drop vehicle to ease the comfort of the patients, and we started with small things but kept on improving with the 4 years, last 4 years. Yeah.
That is great. Ma'am, when we talk about entrepreneurship, the word business comes itself. And business relates to commerce, money. So do you feel that there was one factor that in clinical job of a physiotherapist, money is not that hefty? So was this also a factor in choosing entrepreneurship?
Well, frankly speaking, the main motive, the main objective was to have a little more freedom, because entrepreneurship to me is like doing what you want to and doing it the way you want. So every day you have the freedom of having a new idea, executing that new idea all by yourself. So it's like being the employer and employee at the same time. Right. So a financial thing wasn't a very big issue, I would say, initially, because with experience, there are nowadays a lot of jobs that pay you well, that respect your skills, knowledge, and everything. So that was not the only reason. Yes, sometimes, of course, we used to feel, everybody feels that there's a lot more efforts involved in clinicals if we look from our point of view in any other medical profession. So even our consultation, our assessment, everything, so much of time, efforts, knowledge, everything. So yes, money, of course, wasn't there as much. Now we have that freedom to make our own decisions, make our own protocols, set our own, parameters. To some extent, it was there.
To some extent. Ma'am, when you take such a bold decision, especially when you move out of the box, when you think out of the box, and being a girl, which is very much prevalent in India, did you go through any professional jealousy or did you have anyone who pull you down or any other thing that you felt that was that would I name as criticism?
See, whenever you do something out of the box, as you just said, you are bound to face criticism, you're bound to face oppositions because our mindset here is very much clear that, go with the flow, right? Everybody wants to go with the flow, do whatever you want to do, but not doing anything which is against the norms. So, of course, I won't name like, but basically, all the other, the people who are in a part of rehab team, always obviously some of them felt that being a physiotherapist professional is always, it's not independent, it's dependent, it's referred, it's that way. So if we are doing it ourselves, like Physiocure, I would say, is a institution by physios, for physios, of physios. We start with all together. We had a team of 25 physios. We decide every day what we need to do, how we need to do, and everything. So some people, of course, felt that this independence is not good, and they always need to be on a referred mode, on a mode where we can always dominate. But then there were people also, I would say a lot of good, experienced doctors of with whom I have already worked, like cardiologists, pulmonologists, who really supported the decision, who felt that yes, if you can do it, yeah, it gives a motivation and morale to even them who want to, start a lot of their work alone independently. So it was a mixed thing, and that's the, I would say, the flavor, the taste of it.
Yeah, it comes along with that way.
It's a part and parcel.
When we talk about physiotherapy, there is always one considerable fact that physiotherapists and surgeons can never be good friends, or they always have a fight. They are always seen as competitors, unsaid competitors, and even students of MBBS, students of BPT, they fight amongst themselves. But don't you think that when a physiotherapist takes something out of the box, out of the legacy, it is the surgeons who support their ideas and not the colleagues, not the physiotherapist altogether? Don't you feel that in our field, it is us, it is all other doctors who actually pull us down and not those surgeons who we feel as competitors?
I think it's in every field, you know, anyone who is giving more of results, using an innovative approach, doing things which, are not very conventional. It's obvious that people think that something has to be done. There has to be, 1% fault that could say, no, no, that's not right. So everywhere it was there. It's there today as well. When we are using our pick and drop things, there was thing that why ethically it should not be publicized, it should not be, used. But I feel it's not publicity in medical profession, it's more about awareness, right? When we aware the general public, the layman, the public who doesn't know that they can directly come to physiotherapists for certain things, they don't have to wait for months together to get a referral and then visit for small or big things. So it's more about education. So at Physiocure, we have always worked on the education part. Some people were, of course, not happy with it, but some people always motivated and supported us. So I think I enjoyed every part of it as well.
Talking about Physio Times, what was the idea behind Physio Times? Why is Physio Times being there? In the sense, is it published only for the physiotherapist, medical professionals, or for the general people as well?
Well, see, Physio Times is a legacy. It was started in 2009 at Ahmedabad, and it was run from there since for 10 years. And then when the digital era arrived, everybody switched to their mobiles and tablets. And there was that lack which could be felt of, getting the books, reading the books, holding them tightly, keeping a library. So that was all being replaced. So at that moment, it was I would say, an emotional decision to take over Physio Times and not the legacy die. It should not, the students from 5 years now should not say that they don't have anything specific in that. So yes, Physio Times is a magazine for, by, and of physiotherapists. It's basically to connect the whole community globally, so that we don't feel left out. If so now physiotherapy colleges are everywhere, not only in Mumbai, Delhi, Bangalore, but
Mhm.
everywhere. So the students there should not feel that they are not in touch with what is happening globally. So it was designed for that. But now I'm very happy, since last 5 years we had a great support of not only the physiotherapy community, but also of course of the doctors, the surgeons, orthopedicians, neurologists. We have guest articles from them, we have a lot of support from them, plus the athletic community as well, because sports physiotherapy is such an important part of physiotherapy. Not only that it has a lot of glamour and glitz attached with it, but yes, it has a lot of hard work and it's appreciated widely. So for that, we have a support. I'm very happy that we covered a lot of the Olympians, gold medalists, Neeraj Chopra to Mirabai Chanu to Ankita Rena, and recently we have been talking to a lot of people. Also, from other counterparts like the osteopaths, the other rehab persons, they have also been discussing, giving good interviews, trying to work with the physiotherapy community to give better results, more than physio is what they're aiming at. So we had support from everyone, and now it's being circulated to the even the IITs as well. We had collaborations with IIT Kanpur. We have collaborations with Guwahati, BITS Plani. So even engineering, because they also feel कि जहाँ sports है वहाँ physiotherapy आ जाता है. So it's for now. It's not for laymen, because see, it's difficult to understand the technicality that's involved in the articles, the approaches that's there. So I wouldn't say it's for laymen, but yes, for all the other medical, rehab, athletic community, it's good.
As the editor of chief in Physio Times, ma'am, would you agree to a fact that there are several doctors, there are several medical professionals, there are several physiotherapists who are doing beyond the legacy, who are doing beyond the general set limits in the field of physiotherapy? They are doing everything to spread the awareness. Since we just had a conversation that it is not about publicity, but about spreading awareness. So they are doing their bit, but they do not get the they do not get the deserved recognition they should have. So at a position where you are, don't you feel that you have that power of actually giving them the recognition, actually making them famous, or actually connecting them to the world of physiotherapy?
Yeah, yeah, absolutely. That's why we have a section called Physio Speaks, where we try to, to understand their mindset, read their journey. That's why. But since we have 6 editions in 1 year and limited, we cannot cover everyone. That's why we have also started with the digital platform, the Facebook page and Insta page, of where we can share your stories. We'll definitely try to start with the next edition. July 24th will be the fifth golden 15 years celebration of Physio Times being there. So with that, we'll be soon starting other platforms where we'll try to recognize. Of course, I'll be starting with uh, a same platform like a podcast or a YouTube channel where we're talking to the physios who are making a difference in whatever they're doing, may charitable or they're by their skills and knowledge, or being knowledge and awareness, or guiding the students, motivating them. I'll make sure that we try to, cover all of them, give them the due recognition, and it'll be soon, within a month or two, we'll be starting it.
Well, congratulations and best wishes for that. Moving on, as an entrepreneur, what do you feel are some steps that you have already taken or you wish to take to uplift other young entrepreneurs? Because we have today's listeners and viewers who will look upon to you and who will definitely get inspired to have a journey like you. So what are some steps that you feel that you need to take, you have taken or you wish to take to uplift them?
First is a team, building a team, because entrepreneurship doesn't end with, of course, it starts with one person, but it doesn't end there. It needs a lot of, winding, interwinding, connecting with the same thing. Your team has to follow your principles. So the first step is building a good team, and I've been very lucky to have an amazing team since day one. They were young physios who just completed their degree and wanted to do something different. Didn't wanted to just join a hospital or under a specific category what normally is. So we had that team, and we are continuing with that. We have regular training sessions. We have regular, Physicure Academy is providing a lot of workshops from basics to advanced, from the cupping and everything to the advanced osteopathy techniques. So first thing is we are connecting a lot of physios, training them in our methods and our protocols, which is specifically very important for documentation. We are very hard and fast with documentation. Everything needs to be documented. Everything needs to be, patient has to understand basically what is being done with him and what are the results, and then accept it. So we have been training all our team. Of course, I want to extend it through Physicure Academy to others as well. So that right now, yes, I'm very happy to announce that we are also having a tie-up with the higher skill development centers with so whose support will be doing a small 6 months courses, hands-on courses, where we would like to have all the physios connected on all the centers of Physicure, and have the online and offline sessions with the experts. The first one we're starting with is a neuro rehabilitation. So yes, of course, that practical approach has to be practical.
Great. Now, moving on to a segment which is named as Ask the Doctor, where we have certain questions which viewers, the general audience, has given from me to ask you. I hope that you will answer all those questions. Let me start with that. The first questions comes from Vivek Malhotra from Delhi. He says, "Hi ma'am, I am a young fresher physiotherapist. I have a lot of good ideas, but I do not have fundings to start my own clinic or business. How do I start ahead with this?"
Well, Vivek, initially I feel experience and courage goes hands in hands. You cannot expect everything to happen in day one. So first, as you said, a fresh young physio need to have some hands-on experience of everything, from your clinical skills, knowledge to the market, and how to take risk, how to calculate risk. All those things have to happen. So uh, take a leap of 4 5 years, or build a community of good persons who will believe in you, help you out in getting other advances like funding and all, and then venture into it. Of course, there's a lot of more options there, but then take some time, think, because entrepreneurship is, as the definition says, it's a risk. So be ready for that risk. Build a good team of people around you who will help you out in everything, and of course we are there to help you out as well.
Absolutely. I feel money is eventually a factor that stops a lot of people, but your guidance would definitely help them out. Next, we have Dr. Amita Pandey from, okay, she's from Bhopal. She says, "मैम मेरी इंग्लिश उतनी अच्छी नहीं है, तो क्या एक फिजियोथेरेपिस्ट होने के लिए स्पीकिंग स्किल्स का होना जरूरी है?" So
um, uh,
basically, I would like to add over here for all the viewers that how do you feel communication skills or professional skills are a part of this?
See, of course, communication is a very important part of everything. I feel everybody believes in that. Without proper communication, nothing can be achieved or done. Take it, whatever thing you're doing. So, as a clinician, we communicate well with our patients. Language is not a barrier. I think at least here, if we talk about Central India, English, Hindi, or whatever is comfortable, you should be uh, effective communicator. That is what is important. आपको अपनी बात कहना आना चाहिए लोगों से कि आप क्या करने जा रहे हो, क्या करना चाह रहे हो, and that is what the people should understand from your point of view. So yeah, English, Hindi, थोड़ी practice will help them out. People work in South, people work in different parts, go to here and there and learn languages. So yes, I don't say that English should be totally discarded, because sometimes that helps in giving you a platform. But yes, whatever language you use, you should be confident and a good communicator.
Absolutely. We have another question coming up from Amisha Gupta from Delhi. She says, through physio times, how can an intern or a physiotherapy student can take up issues or speak about the issues we go through in our journey?
Okay, for see students के लिए, again we are trying to make a page available where we'll be say the student speak section, where students can definitely talk about their journey, their experiences, their problems, their successes, they can talk about them. So I'll try to incorporate that in the print editions as well. But if not, then we can definitely have it on our digital media. We'll be soon having the website as well upgraded, where you can do a lot more things. So students are most welcome to join the community and talk about this.
Absolutely great. Well, here the segment is over. Moving ahead to the questions directly. What do you feel is social media presence important for a doctor, for an entrepreneur in the field of medical? We have seen a lot of doctors on LinkedIn every day celebrating in another achievement, but eventually we do not know how much is this true or how much this actually means. So, to actually get into the fact that is social media presence all over the social media presence is important to become a good doctor.
I feel social media is the reality of today. We cannot close our eyes and say, no, it doesn't matter. Of course, at the end of the day, it matters because it connects everyone globally, locally, whatever. Patients are seeing what we as physios or we as clinicians are doing. We are seeing what the others are doing and getting inspired, motivated, getting something at least comes. If I talk about myself, every day I get a new idea after seeing a lot of people doing a lot of stuff. That's important. So we cannot say, it has no importance. It has an importance. Yes, but boasting about certain things is not good. You have to be practically relatable, and you have to be true to whatever you're doing. Like about testimonials, it's not important that every patient gives you a positive testimonial, but yes, whatever is the correct, whatever is the present state of patient's mind has to be captured. So what I feel is what you do should be there, and if you put that genuinely, it helps you. That's it.
That definitely does. As an entrepreneur, do you feel that there are certain foundations you still have in your way, or do you feel that there are still certain limits that you wish to cross but you cannot cross, being labeled as a doctor, or anything, any foundations you would like to discuss over here?
Well, foundations, yes, in medical profession, we have a lot of foundations. We cannot directly preach, we cannot directly negate anybody. We cannot say that XYZ had advised you this, but that's wrong and this is correct. So there's always that difference in opinion as clinician from other specialities that we sometimes differ, vary. So we cannot say that directly, right? So what we can do is we can show our work and give the results, and that what speaks for the patient. So I guess we have to have certain more freedom in expressing that. Like if we have a product, we can market it, we can connect with a lot of audience directly. But as a service sector person, we cannot do that. We have a limitation. We have to be not preaching, as you say, about what we can do and how we can do, and we can give, I think the result speaks. That's what we can do to manage.
On a personal level, what are some steps that you have taken to spread awareness about physiotherapy? Only physiotherapy. Because we have seen, yes, eventually in the growing era, people do know about physiotherapy because of their personal interaction encounters with a physiotherapist or the injuries they have been occurred to them. But do you feel that there are certain steps that you have taken in your long journey to actually spread the awareness only about physiotherapy to the common world?
Yeah, that I think always I thought that that's very, very important. And I have started with, just wearing on every possible platform since last 10 years, I guess. I have been doing a lot of Doordarshan shows to aware people about everything like geriatric rehabilitation kya hota hai, lakwe, and of course that's a very basic thing, but then cardiac physiotherapy bhi hoti hai, usme kya importance hai. So I've been doing a lot of talk shows wherever possible, from Doordarshan to private news channels where we can Ayush programs where we can talk about people, talk about basic, ask people that give people the option of asking us questions. We have been doing things. Then we have been writing in some of the other daily blogs, articles, wherever it's available. And of course, at a local level, we have been conducting camps to, at everywhere. What I say is, wherever there are people, there is the need of physiotherapy. Take it preventive or treatment or supportive, but everywhere we have to have a, an image. A presence is very, very important. If we go for an ergonomic consultation, we go to banks, we go to the corporate areas, and just take a quick webinar, seminar, whatever is available, to tell them that don't wait for your body to get that pain and aches. Always start early. Involve with us in a preventive aspect. Physiotherapy is magical if we start preventively. And then I've been taking a lot of seminars in my son's school as well, talking to kids about posture correction, and what physiotherapy is from that level, from class 5, 6, and that level, so that they're not unaware till class 12, and they get, okay, it's a secondary option. So they have to have that image from right from the beginning. So we do a lot of stuff, and I love doing that.
That is absolutely great. Well, Anubha ji, you were not Dr. Anubha since the beginning. You were Anubha, you were Anubha ji. What all it took for you to actually become the Dr. Anubha Singhai everyone looks upon to actually become the source of inspiration for everyone.
I don't think, see, if a source of inspiration is too heavy a word, I think everybody is doing their work, and some are lucky enough, blessed enough to get that attention, get that opportunities, and and when the opportunity strikes, we have to take that step. We cannot hold back. That's what. So I would, just say that every young physio who has just started their career, or sometimes they get, okay, if they have to do the same throughout their life. So no, it's not that. We have a lot of options in physiotherapy as well. Just think. Even to my team, with every interview, I say, you don't have to do the conventional thing. We're not hiring you for that. You have to think every day and participate in the team efforts. Give some, you make your presence felt. So that is what every small steps lead you to one to another, and ultimately after some time you feel you've done a lot. So that's it.
Well, at the end of the show, I would like to spread a message or to show your message to all the young physiotherapists who are listening to you. What would be your one piece of message to them that you feel would be a source of learning towards them?
I would say those who fly solo have the strongest wings, right? So don't be afraid to do anything for the first time, or being the first person to do it. Take that step and believe in yourself. Have that strong determination. Of course, confidence comes only when you are confident about yourself first, and then you take the steps that get the confidence of others as well. So believe in your strong wings, fly alone, and everybody will join.
Well, that is really great. And I do hope that all your wise words would have shaped so many futures in the past years as well. And now also to many viewers and listeners, this will be really inspirational towards them. I would like to thank you, Anubhaji, for being a part of this interview and taking out time from your schedule to have a word with me and my audience. I really hope you enjoyed the show and I look forward to have you on board once again.
Absolutely. Thank you so much. I really enjoyed it. And of course, looking forward to connect.